So, good day. So, I am Shaynan Kaligiran from BSN 3A. So, my topic for today is about tonic-clonic seizure. So, let me just present this PowerPoint presentation. So, we have the tonic-clonic seizure. So first, I am going to define what is tonic-clonic seizure. So tonic-clonic seizure is also known as the grand mal seizure. So it's a generalized type of seizure that is caused by abnormal electrical activity throughout the brain. So grand mal seizure, I think it affects the entire body and may happen not just once but multiple times. So multiple times those are cases of epilepsy na. So signs and symptoms later on I'm going to um, discuss more of that briefly, but usually kasi ang tonic-clonic, it causes a loss of consciousness for the patient as well as a violent muscle contraction. So ito yung usually na pumapasok sa isip natin na type ng seizure o yung kung ano man napi-picture natin when we hear the word seizure, yun. It's the tonic-clonic seizure. Malalaman natin later on kung bakit. So it is comprises with two different stages. We have the tonic phase and the clonic phase. So for the tonic phase, this is where the loss of consciousness occurs. So usually dito din yung muscle contraction that causes the person to fall down. So itong phase na 'to, it usually, lasts around 10 to 20 seconds. So ang clonic phase naman, nandito na nagkakaroon ng rhythmic contraction yung mga muscles. So therefore meron siyang alternate, flexing and relaxing. So yung convulsions dito sa, clonic phase, it usually lasts within 2 to 1 minute. So 1 or 2 minutes or less. So next slide. We have the etiology. So the etiology includes alcohol and drug withdrawal. We have brain infection, brain injury, brain tumor. So all of this actually, they have a particular effect on the brain, which is an abnormal electrical activity throughout the brain. So we also have certain genetic conditions such as phenylketonuria, which is the inability to break down the amino acid phenylalanine. So why is it part of the etiology? So bakit naging part ng etiology ng grand mal seizure ang phenylketonuria? This is because we all know that phenylalanine is a essential amino acid that is used to produce proteins. So these are also signaling molecules. So if there's an inability to break down phenylalanine, that can lead to abnormal phenotype growth failure. So usually nagkakaroon ng intellectual impairment sa mga clients na may phenylketonuria. So when we say intellectual impairment, of course, it goes without saying, nasa brain, 'di ba? So nagkakaroon ng neurological problems. So usually mga neurological problems na ganito, this can cause tremors or much worse, seizures. So that's that. And then we also have dementia and encephalitis. So what is encephalitis? We all know that it is the inflammation and the swelling of the brain due to a viral infection. So again, um, sa brain na naman ang target nito. So nagkakaroon ng infection or autoimmune response ang brain. So nagkakaroon ng chances na mag-brain or mag-swell ang brain, which can lead to headache, stiff neck. We all know that nagkakaroon din ng sensitivity to light, mental confusion, and also it can lead to seizure. And then of course, lastly, we have the recent brain injury. So we head on to the risk factors. So what are the different risk factors? We have certain genetic conditions, family history of epilepsy, recent brain surgery, recent head injury, and recent infection of the brain. So here is the pathophysiology of the tonic-clonic seizure or the grand mal seizure. So it's actually two-page. So medyo complicated siya. Tinry ko na maghanap ng patophy that that is summarized kumbaga, pero wala akong nahanap kasi siyempre nga mahababang process kasi nga tonic and myclonic, and then later on I've learned na meron din siyang post-ictal phase. So this is that. So for the etiology, the first part of the pathophysiology, again, siyempre nagkakaroon ng altered integrity of neuron in the epileptogenic focus. So what is epileptogenic focus? So that focus is the site of the brain in which the seizure is originated. So usually, ito yung area ng cerebral cortex na indispensable sa generation ng clinical seizures. So dito nagmumula, dito yung site or the part ng brain na pinagmumula ng clinical seizures. So, what are the predisposing factors that can affect the altered integrity of the neuron? We have family history as well as the precipitating factors. We have sensory stimuli. So, of course, kapag altered ang integrity na ng neuron, nagkakaroon ng hyperexcitability state ang mga neurons dun sa epileptogenic focus, which can lead to partial depolarization. So we all know that depolarization, it's a change, 'di ba? Change within a cell or within a neuron. So nagkakaroon ng shift dun sa electrical charge distribution ng neurons. So this can result with a negative charge inside the cell. So 'pag nagkakaroon ng partial stimulation, of course, imbalance na yung release ng neurotransmitters. So what are the different neurotransmitters? So may excitatory and inhibitory tayo. Ang excitatory, uh, those are the transmitters that promotes the generation of the electrical signal called the action potential, 'di ba? So nire-receive niya yung neuron. While sa inhibitory, from the word itself, it prevents it. So imbalance na yung release nun. Kasi nga siyempre nagkaroon na ng stimulation. And then of course, kapag imbalance ng release, nalo-lowered ang seizure threshold. So when we say lowered ang seizure threshold, it corresponds to a proconvulsant effect. So ibig sabihin, with activating precipitating factors, it can lead to grand mal seizures. It can lead to any seizures na, kumbaga prone na siya to have that seizure. And then, of course, there's a abnormal spontaneous spread of electrical discharges. So we head on to the second page. So this is the continuation, of course. If there's an abnormal spontaneous spread of electrical discharges, here comes the hyperexcitability of neurons in the brainstem na. So this causes disruption na dun sa different parts ng brains or the different areas ng brains. We have the medulla oblongata, we have the pons, and of course, the midbrain. So if it spreads to the both hemispheres, the left and the right hemisphere of the brain, diyan na papasok ang tonic phase. So, tonic phase, we have, of course, sa medullary. Mag-focus muna tayo sa medullary or the medulla oblongata. If there's gonna be a disruption, oh, wait lang. So, what is medulla oblongata? What is the main function? So, medulla oblongata, this is uh, ano tawag dito? It is responsible for the respiratory or respiration and the cardiovascular activity of the client or of the person. So if altered ang function ng medulla mo, of course there's gonna be manifestation of apnea, cyanosis kasi nga 'di ba cardio and respi. So next is the pons. So what is the function of the pons. So pons, it usually works with medulla oblongata though. So they also serve as or it usually serve as a critical role in generating the respiratory rhythm of the breathing. So usually ang active functioning din ng pons, it's fundamental to REM, or we all know the rapid eye movement, and also the muscle movements yon, importante yon. So if there's going to be an alteration in the pons, of course there's manifestation of muscle stiffening. So we all know na nagkakaroon ng the extremities is pulled towards the body. So and then lastly we have the midbrain. So midbrain, nagko-connect siya sa brain to spinal nerve. So midbrain, also known as the mesencephalon, So, ang active function niya or important function, it serves uh, in the motor movement, particularly in the eye, in the auditory, and the visual processing. So, kapag nagkakaroon na ng alteration do'n, we have manifestations such as loss of consciousness and swallowing reflex. So, altered din ang swallowing reflex ng patient. And in all that, combination on all that, of course, that's the tonic phase. Nagkakaroon na ng depolarization. So, depolarization, again, nagkakaroon ng changes dun sa cell. And inhibitory impulse starts from the thalamus and interrupts the tonic phase into discontinuous burst of electrical activity. And then there goes after that is the clonic phase. So, again, based on my reading kasi, tonic phase, they usually last until up to ano 'di ba, up to 10 to 20 seconds, while chronic phase, it lasts usually around 1 to 2 minutes. So, imagine yung bilis ng tonic and the clonic phase. So the muscle will contract and it relaxes rapidly. So mabilis ang galaw ng katawan. So again, nagkakaroon ng violent or jerking movements, and also diyan papasok na yung upward rolling of the eyeballs. So for the clonic, after the clonic phase, we have also the post-ictal phase. So if there's a depolarization, of course, based on my understanding, there's also going to be repolarization, or the going back to the normal state of the cells. So for, I think, best definition na pwede ko masabi sa post-ictal phase is the repolarization. So nagiging hindi siya babalik totally into normal, but uh, not less than dun sa depolarization. So the patient is semi-conscious, there's a poor coordination, and mild impairment of fine motor movements. So that is the pathophysiology of the grand mal seizure. Now we head on to the symptoms. So nilagay ko doon is aura because I think most, if some of the patient, actually alam nila, especially those who are epileptic patient na naturuan na health educate regarding the aura. Alam nila kung kailan magi-start yung seizure nila. So usually ang aura nila, it is characterized by hallucination, can be dizziness, or abnormal sights, may smell or taste or feeling, and also anxiety. So after the aura, and now followed the tonic activity or the tonic symptoms. Ano nga ba yun? We have the biting of the cheek and the tongue. We have the clenched teeth or the jaw, loss of urine or stool, control, of course, incontinence, kasi nga, di ba, altered lahat ng system nila. And then we have stop breathing or difficulty of breathing, again, and the bluish skin color, the cyanosis. After that, here goes the chronic activity symptoms. We have confusion, drowsiness or sleepiness, loss of memory, headache, and thought paralysis. So thought paralysis, it's a weakness within a partial part of the body. So very common yun sa patient na nagkakaroon ng seizure kasi nga stress, nagganan to stress ang katawan ng patient. So next we have the different diagnostic procedures. So first we have neurological examination. So the doctor may test the behavior and the motor abilities as well as the mental function of the patient. This is determine if they have a problem with the brain and the nervous system. And then they also consider blood test kasi nga syempre based on dun sa etiology and the risk factors, malaking factor din talaga ang genetic conditions. So tini-take nila yung blood sample to take signs, to check the signs of infections, as well as the blood sugar levels and electrolyte imbalances. Again, third, we have lumbar puncture. So if the doctor suspects an infection that causes the seizure, they may need to have a sample of your CSF. And then we have EEG or the electroencephalogram. So in this test, the doctors attach electrodes, I think, to the scalp using a paste-like substance. So those electrodes, it record the electrical activity of the brain. So this may reveal a pattern that can tell, or that doctor can tell whether a seizure is likely to occur again. So yun. Also, this testing can also exclude other conditions that mimic epilepsy. And then we have CT scan or the computerized tomography. So it uses to obtain cross-sectional images of the brain. So dito makikita or nagre-reveal if there are abnormalities in the brain that can also contribute to the seizure, such as like tumors, bleedings, and cysts. Ganyan. And then we have MRI or the magnetic resonance imaging. So these are powerful magnets and radio waves na nagka-create ng detailed view of the brain. So in this diagnostic procedure, the doctor may be able to detect lesions or abnormalities that could lead to the seizures. Then we also have PET or the positron emission tomography. So this scan uses a small amount of a low dose radioactive material. So it is injected into the vein to help visualize the active areas of the brain and also to detect abnormalities. So we have a SPEC or the single photon emission computerized tomography. So I think the process is just the same with the PET, but it differs with how detailed and with how the test actually follows. So it is a detailed 3D map of the blood flow activity of the brain that happens during a seizure. So, but I think hindi ko alam kung may spec dito sa Pinas, but usually ito yung ginagamit nila sa ibang bansa. Okay, next we head on to the different management. Of course, we have the medical management or the pharmacological management. So I think familiar na tayo sa mga drugs na 'to kasi lumalabas 'to minsan sa psych natin, psych, RLE. So for the medical management, I think not everyone who has one seizure has another one, kumbaga. So meron yung seizure na once in a lifetime lang siya nangyari, meron din naman yung multiple times. So dahil dito siyempre, finding the right medication and dosage can be challenging, 'di ba? Kasi hindi mo alam if it's gonna occur again or not. So the treatment usually involves the use of anti-seizure medications. So ayan, we have carbamazepine, carbatrol, tegetrol. We also have ano pa, Topamax and Dilantin. All of those are anti-seizure medications. We also have anticonvulsants. So we all know na convulsants, sorry, are agents that prevent seizure recurrence. So these also terminate clinical and electrical seizure activity. So they are normally reserved for patients who are at risk for recurrent seizures. So yan, barbiturates, benzodiazepines, and all that. So next, ayan, surgical management. So kapag hindi na effective ang anti-seizure medication, of course, there are um, there are other options for patients who have grand mal seizures. So what are those? We have surgery, of course. So the goal of the surgery basically is to stop the seizure from happening. So usually ang mga surgeons nilolocate nila yung area ng brain kung saan nag-start ang nagbibigay ng seizure. So ayun. And then we also have vagus nerve stimulation. So in VNS, I think a device is implanted underneath the skin of the chest. So ini-stimulate niya yung vagus nerve sa may neck that ang then sinasend niya yung signal to your brain so that inhibits seizures. So with VNS, I think mababawasan yung dosage ng medication mo, but you still have to take medication. Then you also have responsive neurostimulation. So dito, a device is implanted on the surface of your brain or within a brain tissue. So this can detect the seizure activity and also this can deliver an electrical stimulation to the detected area to stop the seizure. And then we have deep brain stimulation. So yung doctors nag-implant sila ng electrodes within the certain areas of your brain. This is to produce electrical impulses that regulates the abnormal brain activity. So, para siyang na-attach siya sa parang pacemaker-like device. So, nilalagay siya sa chest mo. So, yun yung nagko-control ng stimulation. And then lastly, of course, we have diet therapy. Part din yan ng ano ng nursing management, the health teaching. So, patients with grand mal seizures usually they follow a diet that's high in fat and low in carbs. So, we all know that is a ketogenic diet. So, ayan. Lastly, we have the nursing management. So, the first four, ito yung ano, what to do when a person is having a seizure. So, first, we have to place something soft under their head, and we also have to loosen any clothing, tight clothing. So, you have to reassure the person until they recover. So, do not leave them. Wag mo iiwan yung patient, wag mo iiwan kung sino man yung nagkakaroon ng seizure. And also, do not attempt to restrain kasi the more na you restrain them, the more na at risk kayo sa surgery, sa injury. At least ang patient, sa injury, ang client. And then you also have the time to time the seizure if you can, and then gently roll the person onto their side after the jerking stops. Importante din na i-explore and expound yung seizure warning signs and the usual seizure pattern. This is to check kasi nga sobrang dami or hindi naman, pero there are certain types kasi ng seizures. So again, mahirap na sabihin ma-diagnose ang isang seizure kung hindi mo nakita yung pattern niya. So yun, so you have to determine and familiarize the warning signs as well as to how to care for the patient during and after the seizure attack. So after the seizure attack, you have to provide, of course, neurological or vital sign check. So kailangan i-check yung level of consciousness ng patient, the orientation, the ability to comply with simple commands, ability to speak, the memory of the incident kasi nga nagkakaroon sila ng kumbaga memory loss. So hindi sila aware. And then weakness or motor deficits, you have to check for the BP, the pulse, and the respiratory rate. Lastly, you have to health educate the client regarding personal safety. So ito na yung mga kailangan nilang gawin kung nagkaroon sila ng seizure, anong mga kailangan nilang i-prevent and all that. So that would be it. So thank you for listening. Again, this is Shanen Kaligiran from BSN 3A. And have a good day po.